right, people, welcome to One Body, episode 2. I'm Kruesi.
I'm Eden.
And today we're talking about urinary tract infections.
Womp, womp, womp. Okay, wait. Before we do that, I need to know, what is something you wish you had known this time last week?
This time last week, what is today? Today is Sunday. Okay, I started my seed journey.
Ooh, what's seed?
Seed is a symbiotic. It's like probiotic and prebiotic. If you've been on Instagram, you've seen it.
Yeah, I've dabbled.
Okay, this was my mistake. I didn't look into the side effects or anything. So I start taking seed. I'm like, it's a probiotic. I've taken 1 million probiotics, whatever. Just start taking it. Don't even think about it. I'm a few days in, and I am convinced I'm pregnant again. I'm like, oh my gosh, I'm pregnant again. And truthfully, I wasn't sad. Like, I'm down to get pregnant again. But it wasn't like we were totally ready yet.
Okay.
But I'm having crazy nausea, reflux. I'm having reflux. Also, I'm so tired and exhausted, so I don't know what that was about. And I kept getting really lightheaded and feeling like I might pass out. And I was like, oh my gosh, I'm pregnant. Like, at work, I'm like, wow, planning out in 10 months, like, what month is it going to be? We'll have baby number 2, all this stuff. I tell Ethan, I'm like, Ethan, I'm pregnant. Like, can you believe it?
This time last week, I was literally with you.
I know.
You were not giving any signs of this.
I know, because I hadn't taken a test yet. I had to wait a few days. So I take a test, and the first time we got pregnant, I just took a test on my own and told Ethan later that day.
I didn't know that.
Which was fun. But this time I was like, oh, I kind of want him to know with me, so let's flip it at the same time. But I'm like, I'm pregnant, so like whatever. And so I take it down to him, and we both flip it, and it's negative. It's not pregnant. And I'm like, what? Like, I was just so thrown off. I was just confused. I was like, my body
what's wrong with me?
Is pregnant. Like, what is, this test is wrong. But then I still had another maybe week before I was supposed to start my period. So then I waited 4 more days or something. Still horrible symptoms. So nauseous. So this was, I think it was yesterday, actually. I took another test, and I'm like, it's positive. I know it. We flip it over. Negative. Yeah, and I'm like, wait, I'm so confused. I'm just thrown off by my body because it's the exact way I felt with my first pregnancy. Then, ding, ding, ding. Actually, our sister-in-law, Nina, posted something on Instagram where she was like, guys, I started seed. We started at the same time. I don't even think I realized we were starting it at the same time. And she was like, I'm so nauseous. I'm dry heaving. I'm about to pass out. So I'm like, oh my gosh, it was this stupid probiotic.
Yeah.
Which I am still taking because I think that will get better. And apparently if you take it at night, it helps. Or if you take it with food. And I'm only taking 1 pill. Anyway, there's all these things. I just didn't even look at the side effects, especially during the first week. You have this transition period. So I think it's pretty common to feel really shitty. But I was like, I just wasted multiple pregnancy tests and a lot of thinking about being pregnant.
The fact that you get Ethan every time.
I'm like, I am. Like, it came up so many times where he's like, wait, why are you so winded? And I'm like, well, I'm pregnant.
Well, obviously.
Wow, and then I'm like, actually, no, I'm just taking a probiotic.
Like, was on the seed subscription, paying for it for probably 5 months. And
it's kind of pricey.
Like, yeah, I know. I like couldn't find the email. I couldn't figure out how to unsubscribe, of course. I also just wasn't good at taking them. But the thing with any of these, like, probiotics, prebiotics, I don't want to be nauseous for 2 weeks before so I'm terrible. Like, I don't know. Maybe one day. You wish you had known the side effects of seed.
Yeah. I wish I had known that I wasn't pregnant and not spend a week preparing my life for this baby. That's not yet happening. But hopefully it does happen in the future. But
you're feeling better. Like, would you?
Well, I didn't take it today because I was like, yeah.
And the reason you're taking it is for, like, bloating?
Yes, I've been having such bad bloating, and I don't know. The weird thing, too, is I've been so constipated since I'm taking it. I've always been very regular.
See, I don't know.
But that's another common, like, the first few weeks, it either makes you too regular or constipated. But, I mean, it was like 4 days without the BM.
The BM.
Which was so bad. I felt horrible. And that's also why I thought I was pregnant. I'm like, I'm already showing that.
I'm literally in my 3rd trimester.
Yeah. My stomach is like out here. I can't even close my jeans. I'm like, Dang, so that second baby really hits.
We got to get into bloating one day because it is,
Yes.
Since you mentioned that you were bloated, I feel like I've been, like, painfully bloated.
It's terrible.
I'm like,
yeah.
What's going on?
I have some friends who work in GI, so I'm going to holler at them.
Yeah. Stay tuned.
Okay, what's your wish you knew?
So this time last week, I wish I freaking knew that our pickleball times were coming to an end. My husband and I,
Wait,
I know.
why?
I know. Just, I'll let you know. So we joined a pickleball league. He's pretty good at pickleball. I'm not good at pickleball, but it was like something fun for our marriage, something to
Richmond is really sneaky good.
Yeah, he's tall.
You wouldn't expect it
because
he's
really
like
long
he looks
arms.
like he plays like I don't know, a more. I'm not trying to bash pickleball, but a more like legit.
It started as like an old people's sport.
Yeah,
or it used to
but
be.
then
an
he
old
plays
people's
it.
sport.
He's like.
He does like a back. He like spins and he's like. I'm like, what are you doing?
Yeah.
It's great. I just
cool.
sit in the back on my heels. I'm like,
Just ready.
yeah.
Move your feet.
Woo. So we made it to the quarterfinals. We beat this team like pretty bad. Like it was kind of awkward.
Oh.
Like you play one team for an hour, and then whoever has the most wins in that hour moves forward.
Oh my gosh! Yeah, so you can't like.
So
call
we
it
beat them a
quits.
lot. Yeah. So then we make it to the semifinals. We're playing a team that we've played before and nearly lost to, but I'm feeling like we're going to win. So this is going to be so awesome. I'm already picturing us playing in the finals, which would be this coming week. I was like, we're so good. Like, this is a comeback story. I'm so good at pickleball now. And we had a doubleheader, so it just wasn't fair because the team we played in the semifinals came in fresh legs, ready to go. And I just like halfway through the game, it was so hot. It was like 97 degrees. I just like couldn't do it anymore. Like I literally,
Oh no!
I was just,
Mentally,
like,
you just
shutting down. I was like, am I like stroking out? Like what's happening? And then my parents came the last 5 minutes, and I was like, I was so mad. Looked so awful. I was like seeing every shot.
Wait, what do you think was wrong? You were just too tired?
I guess I haven't. Shoot, not to say anything bad about Pilates, but there's not a lot of cardio. So I think I just hadn't
Different muscles,
and it was actually so hot, and I hadn't had a lot of water, and so I just was a little bit behind. And then once I got it in my head that we weren't gonna win, all the motivation left me. So now we're done with pickleball.
So you were cut.
It was our last game.
Oh,
So I wish I had known it was gonna be our last game because I obviously would have tried harder.
Would have gotten into another gear.
I would have got
Wait, was Richmond mad? How does he respond in those?
He was also making some silly mistakes. It was pretty mutual.
That's good.
Dang it, what are we doing?
Yeah.
It just was frustrating because I think we really could have beat them. And I am very competitive. And he's competitive, but not necessarily when it's like me and him.
He's like, this is for fun.
Yeah, this is just for fun. But he was getting on to me. He was like, you're being a sore loser. You need to not be a sore loser. And I was like, I'm not a sore loser. We went out to eat. That was supposed to be our celebratory dinner after making it to the finals, which we shouldn't have said. And I was just a brat the whole time. I was like, I hate this. Sushi isn't even good. He was like,
hate sushi. Wait, where'd you go?
Toto, Sushi and Grill.
Toto.
Which also, I wish I had known, they stopped their 2-for-1. So, no.
What a bad day.
What a bad freaking day.
Horrible. What are y'all's favorite chat restaurants?
Chattanooga, Tennessee restaurants, you have to go to Wooden City. Okay, you've got
Wooden City.
Wooden City. It's a fun vibe.
Never heard of it.
Yummy cocktails, pizza, burger. Old Man Rivers, super cute.
Never heard of it. It's like I'm not even from here.
Super cute. Kruesi, it's really good, and I discovered it later. And Main Street Meats, Aaliyah.
Aaliyah. I thought the
Need Loves.
Standard was now the new Aaliyah. The Standard?
I haven't been there yet, but I've been to Second American.
Oh, wait. No, that's what I'm trying to say.
Yeah.
The Standard is in Atlanta.
Yeah.
Okay, Second.
But stay tuned because I joined a soccer league.
That's awesome.
I know, I'm so scared.
I would be
5x5
so
futsal. I ordered Earth cleats. Yeah.
Wow.
About to be in the backyard doing drills by myself.
Go to get Code out there with you.
Yeah, but he'll pop the ball.
Yeah. I haven't played soccer since my Charlotte days, which was now like 6 years ago. It would be really
same.
embarrassing. It would be really... But I'm proud of you.
Mine was since high school, which I think was 8 years ago.
Yeah, it's going to be
Just
rough.
so wild. But I'm trying to get myself out there in the sports world. And it's fun to do something after work. Like, it sounds crazy to have a soccer game at 8 p.m. on a Tuesday night, but I'm like, why not?
Why not?
Free will.
Especially before you have kids. Like, just
let's just
do those fun leagues, and I think that's a great idea. That's what I was doing in Charlotte, too. It was fun. Okay, so let's talk about UTIs, urinary tract infections. Very, very common, more common among females than males for mostly anatomical reasons, because the urethra, or the opening of it, is a lot closer to the anus, the booty hole.
For a woman,
because a man's urethra is much longer, and, it's like hanging down. And so the distance is further. Yeah. A lot of the time with a UTI, which just means there is infection of the urinary tract, bacteria gets up in there and causes infection. Commonly what happens is, it sounds gross, but bacteria is very mobile and can move from place to place a lot more easily than you would think. So it's not because of poor hygiene. It's just that a lot of the time the bacteria from the anal area can move into the perineum, which is the space between, and then into the opening of the urethra, which is called the urethral meatus. And then it can basically make its way up the tract. And then if it sits there long enough, it can start building and cause an actual infection. So, picked it again because it's a common thing that people in our season of life deal with. So quickly to go over just the simple anatomy, you have 2 kidneys on either side of your flank here, kind of like your mid-back.
Flank.
In like boxing when they say to like...
Flank steak.
Steak is right there.
My favorite. Okay.
Where you're like supposed to punch them. It's like, punch them in the kidneys. Yeah, so if you think of that spot on the side back.
Okay.
That's where your kidneys are. Your kidneys filter your blood and form urine, which is a discard of the things that you don't need. And your kidneys keep your blood volume in balance. They keep your electrolytes in balance and your acidity of your blood in balance. So the urine is the discard of that, and it forms in the kidneys. And then you have your ureters, which are just long tubes that collect the urine from the kidneys. Those drain into your bladder, which is just a big sac. It's a muscle. And it collects. Once it has enough pressure, it stimulates the muscle to contract, and that pushes the urine out through your urethra, which is the tube that connects to your pee hole, which is, your first hole. If you're a female, you have 3. So it's the first one. The highest, yes. Most superior. So that's the anatomy. So a UTI is an infection of somewhere along that tract. Typically what we would be experiencing is what's called acute cystitis, which is infection of the lower urinary tract. So that's the bladder and below. Nothing's getting above that. If it gets above that, it becomes a much bigger issue, and that's called a complicated UTI. If it's in the kidneys, that's called pyelonephritis, which is infection of the kidneys. That's a more systemic infection. You have to have a more potent antibiotic that covers more bugs. And sometimes if you're really sick and you have sepsis, which is an inflammatory response of the body in response to the infection, then you would have to be hospitalized and have IV medications and IV fluids. We're not talking about that today. Today we're talking about acute cystitis, which is just bladder and below when you have infection.
But if left untreated, could turn into complicated.
Mm-hmm.
Okay.
Yeah.
And you said, what were the different, before your urethra, the different tracts? What are those called? From your kidneys?
Oh, ureters.
Okay.
Tubes.
Okay. And then your bladder.
And then your bladder, and then your urethra. Okay. We also will have little summary sheets attached to the episodes that have a photo of this and go over some of the basics. It's just, if you're super nerdy and you want to be extra smart.
And a visual learner,
Yeah, then that will be helpful. So we talked about what causes it. A lot of things can make you more at risk for it, and some people are just more prone, and it's sometimes not even understood why. Sex, a lot of the time, can cause it, just because if you think about, things are moving around, things are happening, you can easily drag up some bacteria, and that can
But it's from your butt? Or from either person's
area,
butt?
Yeah. Yes.
Oh, okay.
Okay, so your GI tract, your feces, your poo, has the most common bug or bacteria that causes it, which is E. coli. So that just sits around. It's just on your skin around there. So if you wipe back to front, it could also drag it up.
If you wear thongs.
I have not heard that actually being
just
true.
Kidding.
But
I've heard people say it's up your butt. A thong is like
Yeah,
up
but
your
like,
butt.
why would you move it forward from there?
I don't, if it just happens to move or if it's just like.
That's true.
On fabric.
Yeah. Okay. Rarely there's an anatomical issue with how the urine is draining. Sometimes there's a functional issue where you're not draining your urine adequately or not quickly enough. And then when the urine sits there, the bacteria can grow. Bacteria loves wet, warm environments. So it's really important to not hold your urine for forever, which sucks as girls because we have to pee a lot. The other thing is you want to make sure when you're peeing, you're relaxed and you're fully emptying your bladder. That way everything's getting out and nothing's sitting in there. That way bacteria.
What about like pushing? Like sometimes I'm like really trying to pee fast.
Power pee.
Yeah, because I'm like, I
Power
have
peeing
2 seconds in between a client. I'm like, ugh.
It's so bad, but I have to do it too. It's not bad for UTIs, but it's like pelvic floor dysfunction. It can cause it to become really spastic.
And then sometimes I will stop a pee because I'm like, this is a good flow, but then it becomes a light flow, but the flow won't stop. I'm like, I could pee for a long time.
Don't do that. Okay. Don't stop your pee. You gotta pee.
Just relax
on your pee's time, okay? Don't rush it. All right, so we talked about E. coli is the most common bacteria. It's like 75 to 95% of cases are E. coli. There are some more rare bacteria, and some of them need a different antibiotic, but probably not. If you're typically healthy, you don't have risk factors like living in a nursing home or a hospital or something like that, or you're not on immunocompromising medicines. The light is about to take out our camera in our faces.
Should I put it back up?
No.
Okay.
It just fell from the ceiling. Okay, symptoms of a UTI would be dysuria, which is painful or uncomfortable peeing. So you pee and you're like, oh, it kind of hurts.
But it's burny or no?
Usually it's burning.
Burning.
A burny sensation. Frequency. So you have to pee all the time. Other things can cause frequency though. So if you do have a pelvic floor dysfunction or sometimes older people, sometimes younger people, but mostly older ladies can get an overactive bladder, which is where it's just very sensitive and the muscle will contract a lot more. And then you feel like you have to pee all the time.
So does it just feel like you have to pee or you actually are peeing more frequently?
Both. The feeling is more of it, but then you might just pee in small volumes a lot more frequently. You might have urgency, which is when all of a sudden you have to be and you can't wait. And then suprapubic pain. So that's just kind of pressure, pain like down here in the lower part of the belly where the bladder is. It's just inflamed, so it's causing pain. And that's usually improved with ibuprofen.
Question. You said the bacteria in your butt or in your poop.
Yes.
Do we all, is bacteria always in poop?
Yeah.
Okay.
Yeah.
But then there are worse kinds, like good and bad bacteria, or just like...
Yeah, usually, you have bacteria on your skin right now. It's everywhere. And bacteria is not always bad. It's only bad when it forms into these massive clumps, and then it causes your immune system to start attacking it, and it causes inflammation. So it's like when it grows out of control, it's bad.
Okay. And E. coli is a particular kind of bacteria that is definitively bad.
It's in a lot of places in the body naturally, but it's bad when it's in a spot it's not supposed to be, which is the urinary tract. Yeah. When it's in your poop, you just poop it out and go its way. Okay. But that's also why...
Because you're getting rid of the bacteria.
Yeah. Okay. That's also why you shouldn't drink unfiltered water if you live somewhere where they are not filtering the water for you.
Or like raw chicken. Wasn't that a whole thing with E. coli?
Yeah.
I mean, I don't think anyone thinks you're supposed to eat raw chicken.
Yeah.
But I remember hearing like E. coli with raw chicken.
Yeah. It can be on a lot of different foods. It's a very common foodborne illness. If you get what's the term that people say?
Food poisoning?
Food poisoning. Yeah. Laymen say that.
What do the people say?
If you have any of these symptoms, these would be alarm symptoms for the bacteria being above your bladder and causing more systemic illness. So that would be fever greater than 100, chills or rigors where you're just shaking and uncomfortable. If you have flank pain, that means your kidney is inflamed. And then this area back here is tender. That could be a sign of pyelonephritis infection of the kidneys. Also, there's a lot of other things that can cause tenderness here. You might have a kidney stone. You can have fluid backup in there called hydronephrosis, or things outside of the kidney. So always see your provider. Disclaimer, all this information is educational.
Not medical advice.
Yes, you can't take what we say and not listen to your medical provider. Okay. The way you diagnose a UTI, if you have classic symptoms, and let's say you've had a UTI before, you've gotten urine studies and you've taken antibiotics and it's fixed it. 2 or 3 years later, you have the same exact symptoms. You don't have to get urine studies. So technically, you can call your primary care provider, or you can do telemedicine. You don't have to have urine studies if it's classic. If, let's say, it's not classic symptoms, you're having other things and it's not very clear, or you are having recurrent UTIs, which is defined as 2 in 6 months or 3 in a year.
Oh, wow.
That's called recurrent UTIs. If you're having that, or you had a UTI that was treated with antibiotics, you took the whole course, and within 2 weeks you have a recurrence of your symptoms, then you need to go give a urine sample, which is very simple. It's called a clean catch. Midstream is how you're supposed to do it. So sometimes they don't explain it. So just in case, if you go to your doctor, they say, give us a urine sample. You have to clean the area, again, front to back. Then you let it dry. Then you pee a little bit, little pee, let it out. That washes out the normal bacteria that's colonizing the tube. Then you put the cup down there. You catch your pee midstream. You get however much they want, like half the cup. Okay. You put the lid on. Then you sit down, relax, finish your pee. Oh, okay? Gosh, okay. That's how you're supposed to do it. What they do is they look at the urine. They can do like a dipstick, or they can look under a microscope and they see, are there white blood cells, leukocytes are what it's called, and then nitrites are in E. coli and other bacteria. The bacteria will turn the nitrates into nitrite, and that is a sign of a UTI. And then if you actually culture it, which means you let it grow out whatever bacteria is in there, then you can see the actual bacteria that's causing it. And there's a certain cutoff of how much is a infection versus how much is just colonization, which is again like just normal bacteria that happens to be in that area and not causing an actual infection. So it's not always necessary to get urine studies, but you might need to get them, and it's a very simple and very cheap thing to do. Sometimes you also will have a little bit of blood in the urine if you are having an infection, because it's just inflammation. Like some of the little capillaries might be inflamed. So the differential of things that could be causing similar symptoms, but it's not actually a UTI. A very common one is vaginitis. That is inflammation of the vagina. But a lot of people can't differentiate, is this my urinary tract or is this my vaginal canal? Like they're so close together and the symptoms might be kind of difficult to know. So vaginitis would be like a yeast infection, very, very common, or a sexually transmitted infection like trichomonas, or bacterial vaginitis. We should have an episode on that. It's when like the certain bacteria overgrows and then it will kill out the other stuff, and it causes the worst symptoms. I've had it and it is so horrible. All of these things of vaginitis would be like vaginal discharge, that's increased, a different odor than is normal, itching down there. That's different. You can have urethritis, which is inflammation of just the urethra. And this would be a lot of the STIs like chlamydia, gonorrhea, trichomonas, herpes. That can cause that. Painful bladder syndrome is a diagnosis of exclusion, meaning you have to make sure that nothing else is going on, rule everything else out. And basically when the bladder is distended, it's just really painful. So it kind of feels like a UTI, but there's no bacteria. There's
Why
no
is it distended? Like what has caused it?
It's one of those functional things. Yeah. It's not very clear, but the symptoms are there, and there's just not a clear explanation of, oh, it's a bacteria, or you have this anatomical thing. It's like everything's functioning well, but you're having these symptoms. So you don't treat that with antibiotics because there's no bacteria. And then pelvic inflammatory disease, PID, dun. That's when you get infection going up into the pelvis, and it causes cervical tenderness and discharge from the vagina. That's something you should go to the emergency room for. But if you're having straightforward symptoms, you know you've had a UTI before, you know what it feels like, then you don't have to have testing. Treatment for a UTI is antibiotics, because we have to kill off the bacteria and stop it from replicating. So there's some first-line medicines. You guys have probably heard of Macrobid, is a common brand name of nitrofurantoin is the name. That one you take twice a day for 5 days. That one's very effective. It's the first line. And then another first line is Bactrim is the brand name. Trimethoprim sulfamethoxazine. Trimsulfa. That one you take 2 times a day for 3 days. That one is annoying though because you cannot drink alcohol on it or else you'll have this, it's called a disulfiram reaction where it is horrible. It interacts with the alcohol and you get like flushing, nausea, you feel like you're going to pass out, and it can last for days. So just to know, do not take Bactrim and drink alcohol. Don't even take a sip. Yeah. And only some people get that, but I just wouldn't mess with it. And then there's one called fosfomycin, which is Monurol, which is a powder. You take it one time. Not very common because it's expensive. And then there's a new one. I'm going to butcher the name. The brand is Pivya, and it's Pivmecylinem.
Sounds right.
It's a newer one. That's 3 times a day for 3 to 7 days. So sometimes it's just helpful to like hear the names so you can remember and you can know when you go in like, oh, I've heard that name. Yeah. I can either look into it before I go and know the side effects and know what questions to ask.
And it sounds like you need to do antibiotics.
You do.
You can't really get around it.
You do. I mean, there is a theory of waiting a few days for some people if you don't have any other medical conditions and you are okay with taking the risk of the infection getting worse, then you could potentially wait and then have some antibiotics called in case it's
Why wouldn't you want to take an antibiotic?
I think some people don't like antibiotics because of the side effects, and also it can mess up your GI like microbiome. You rebuild
it's just
it
like
over
cleaning
time.
it all out. Okay.
Yeah. Some of them are worse than others. Like Augmentin can be pretty harsh on your gut microbiome. So some people just, I mean, myself included, I don't like taking them. But if you have a true infection, you should take it.
Get ahead of it.
Yeah. And hopefully it's very far and few between that you have to be on a medicine. So once you start this, your symptoms should lessen within 48 hours. If not, then you need to talk to your provider because it's probably not working. And you can also take ibuprofen for the pain. And then phenoxypyridine is over the counter. You can take that twice a day for 3 days. That should also help. I've taken that. It's very common to get this when you're pregnant. There's something called asymptomatic bacteria, which is when you do have bacteria that's found in the urine, but you're not having symptoms of a UTI. In a non-pregnant, healthy person who's not about to have a procedure to this system, you don't treat it. You don't take antibiotics because it's not actually causing this inflammatory response. But if you're pregnant, you do have to treat it because it can cause a worse infection or sometimes issues with the pregnancy and the baby.
And you wouldn't know unless you do a pee.
Yes,
sample,
so
which you're just doing regularly as a pregnant woman.
Every time you go, you leave a pee sample, and I was always like, "Why am I doing this? This is so dumb."
Still pregnant.
Still pregnant, but they're checking to make sure you don't have bacteria in the urine. Some people also get recurrent simple cystitis, which is, like I said, if you're getting 2 or more in 6 months, 3 or more in a year, then you would need a workup just to figure out what's causing it. Make sure you're actually treating it appropriately. Things to do to hopefully prevent getting a UTI. Some of these are not necessarily in studies found to be completely positive, meaning the study isn't saying this will 100% prevent a UTI, but it's helpful, and these are easy things to do. You need to drink water. You need to drink 2 to 3 liters of water. If you have issues with UTIs, you need to drink water. You need to pee often, so don't hold your pee for a long time. Pee after sex. Again, it's not necessarily proven, but just do it because that way you're flushing out. If any bacteria did get in that area, you're just flushing out so it doesn't have time to sit there and grow. Cranberry pills are a concentrated version of cranberry. Cranberry has some chemical in it that can help flush out bacteria. It helps it like stick to the walls. I think it's called PACs. And so you take that once a day to prevent it. There's a drug called methanamine or Hiprex that is weird. It converts to formaldehyde when it hits the urine if the urine is acidic enough. And you take it with vitamin C to make it more effective. And it kills the bacteria. It kind of freaks me out, to be honest. But if you have issues and you're trying to avoid being on an antibiotic, then some people...
A little chemical reaction.
Yeah.
It's crazy.
Literally like a lab.
Whoa.
A chemistry lab is happening. Some people then, if you're having issues with recurrence, you can take an antibiotic right before and the day after you have sex if you've correlated that that's the issue. And then rarely some people have to be on a low dose of a chronic antibiotic. I would always prefer to avoid that, but usually just for like 3 months and then reassess. Also, D-mannose, it's like a sugar, can help and be preventative. And then other people have tried probiotics because that can help increase the good bacteria in that tract and help you fight off the bad bacteria. Okay, so that's UTIs. Hopefully that's helpful. So I've had one. You have not, luckily, had one.
But I've had yeast infections, and I didn't know the difference. So this is really helpful.
Good.
It sounds like you don't have to be sexually active to get an IUD. You can, a UTI. Whoa. You don't have to be sexually active to get a UTI. No. You can get a UTI at any age.
Yeah, you don't have to be dirty.
Men and women. Okay.
Mm-hmm. It's not that you did anything wrong.
But you should take action.
Yeah.
Okay.
All right, that's all. Peace and blessings. One body. We out.
We out.